Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. This is Caroline. I am co-founder and nurse practitioner here at Fiat. And today I am joined by Michael Ferry. Want to give us a little intro, Mike?
I am the other co-founder of Fiat.
Mm-hmm.
I'm a psychiatrist, practicing psychiatrist here in Franklin. I have 9 children and a little farm.
Love it. Super excited to be here with you today. It's always great to get to sit and chat.
Always
Nice. Last time, if anyone hasn't listened to it, we last recorded a podcast when we first launched the podcast. I don't know how long ago that was, honestly, but it's been a minute. A little bit about our history of how we first got founded. And I wanted Mike to come back and we're going to go over just the year. We're coming up on our 3-year anniversary. I'm recording this about, 2-3 weeks before the actual date of the anniversary. We opened in April 3 years ago. And the first day we opened, it was me and my mom was a volunteer receptionist. And I think we saw like 4 or 5 people and it was so exciting. We still hadn't finished hanging pictures on the wall. and here we are now in a new building and, wait lists and all kinds of exciting things have happened. So yeah, I'm excited to talk about the year with you.
Me too. It is hard to believe that 3 years in, we are helping people the way we intended to, although we have learned a lot along the way.
Yeah. It's been a wild ride. It's been really fun. Okay, so we wanted to first kind of just touch on like what we do here at Fiat, just in case maybe you're unfamiliar, and kind of how it's developed over the years. We started with just this kind of broad idea of integrative health, which I feel like is kind of a hot button topic, but it's really our vision was mind, body, and soul, and to do healthcare really as it ought to be, kind of our slogan, I guess you would say. And so, when kind of reflecting on the year, I thought, well, really our like core mission is like loving God by loving people, and that we are, seeking to pursue the truth about humans and how humans flourish and partnering with people in doing that. And part of that is in how we've developed is we've realized we've kind of have these 3 different, services
right?
that are integrated, but different in how they live out that mission. So maybe you can talk to us a little bit about the mental health side of things.
Right. Yeah. So we from the very beginning had this vision, I guess, when family practitioner comes together and a psychiatrist, we're coming from different angles at human flourishing. But we both understood, I think, from the very beginning that an approach to humans being well and to helping people, moms and dads and kids and families to be healthy included a spiritual dimension, a mental health dimension, and a physical dimension, nourishing the body, nourishing the soul, and nourishing the mind. So a lot of the work that we do is aimed at healing, but that's not all we do. The other whole aspect is aimed at helping and directing and giving guidance in those areas so that people can avoid wounds or getting sick.
Mm-hmm.
So, yeah, we didn't start with a strong mental health component, but we currently have several therapists who are diligently working together. How many therapists now? We have
4.
4, part-time and close to full-time. I don't know the numbers on how many clients everyone is seeing, but this past year has been a scaling up of those services. To me, in my mind, it feels like a coals or embers that if you're just to blow a little bit, it would burst into flame. Mm-hmm. There's a lot of interest and desire and need for good mental health treatment.
Yeah.
And our therapists are very energized around that right now.
Mm-hmm. I'd say overall, like a lot of people come to us because they trust us. Like that's a huge part of, when you are in, let's say you're having either mental health crisis or physical health, something's going on, the first thing you're thinking is like, I want somebody I can trust. And so one thing with our mental health team that I feel like they live out really well is just they challenge this moral relativism that's found in our culture today. And that's a lot of how they live out kind of this mission of seeking the truth in the human person is really like, incorporating when it's fit, spiritual practices, melding those together with that mental health. And maybe one day, as we talk about our vision, adding in that physical component with everybody too. But I just find that that's unique. You don't know when you walk into a counselor's office if they're going to be like, yes, you are a different gender than what you think you are, and so that trust being a huge part of it. Okay, so we have mental health, and then we do primary care, which is kind of our biggest service, and that's how we started our direct primary care model, which we still have to do an episode one day just all about direct primary care.
Yes, we do.
Because it is.
There's some more explaining.
Totally, yeah. It's membership-based model is the easiest way to think about it. But essentially, one thing that is really great about really any direct primary care is that you have more time with patients. You take a lesser patient load in order to be able to spend that time. And there's like fun statistics of like, we increase the average amount of time spent with patients by like 200% compared to an average primary care visit, which is, crazy to me because I don't think we're doing anything amazing. I actually think we're just doing what should be standard. And the healthcare system has fallen so far that the standard looks amazing. And so it's just really treating people as they ought to be treated and being available to them so that they're not ending up in the ER unnecessarily, let's say, or being proactive in their health. So I'd say that's our other, we've got mental health, we've got our direct primary care, and then our other big service that we offer is our women's health. And I think this has been growing over time. Right now we have 2 part-time nurse practitioners who do women's health exclusively. And it's just been really beautiful to see a huge demand for that because women are realizing that birth control doesn't work with how God intended my body. Shutting off my hormones is actually not the answer to my problems. And so right now, unfortunately, there's not a lot of providers that know how to work with the woman's body in God's design in order to seek the root cause of the issues that they're having, whether it's thyroid or infertility or recurrent miscarriages. And really, a lot of what they do is like combating this culture of death and being able to, whether it's help women get pregnant or again, just like teaching women about their bodies to work in tandem with the Lord. And it's just a really beautiful service and really unique, I think.
Yeah, it's unique, and that's unfortunate, right? It's kind of like the mental health side and the primary care side. It's not hard to improve on what is the standard of care because the standard of care in our nation has sunk quite low. So it is unique, and we're finding the demand is high because people know that they're not being sold the truth, and they want to come somewhere where providers, clinicians will listen and will be interested and curious and try to offer them something that lines up with how their body is made and what it's intended for, and how their mind is made and intended for.
Exactly. Yeah, it should be standard. So unfortunately not. But something else that we wanted to kind of jump into and talk about too was kind of the behind the scenes things that go on in the clinic that people don't really know about, especially patients who are just coming in and out. And something that we have done over the years is we've just been super intentional about how we build this business, this brand, this whatever you want to call it, and really forming a culture really intentionally. And so, we came up with core values of things that would really be like our guiding stars of who we would hire, the decisions that we make. I think we can Mike and I both agree that like there's just been so much discernment, and probably anyone who's an entrepreneur knows this, but there's just lots of opportunities. There's lots of things you have to decide. And so these core values really guide us in that. Maybe why don't you speak to us about one of our core values, maybe wonder.
Yeah. Okay. And I would just to piggyback on what you said, I don't know that a lot of entrepreneurs have the kind of clarity that we have been lucky enough to have early on. And even though we are growing by way of many mistakes that we make and learning constantly, that is one thing that we have understood, been blessed with, just learning things from Pat Lencioni and from our Catalyst class and things like that about the need for real clarity so that we can make good decisions based on where we want to go. We know where we want to go. Yeah. So core values like wonder guides how we hire and try to work with and develop our providers, clinicians, therapists, administrative team. We want people who are eager, hungry to understand how things work, who are curious and open, so that just accepting simple directives from a large organization, for instance, about whether red dye number 5 or number 2 is good or bad. No, we want to know why. We want to dig deeper into that and understand, just as an example.
Yes, it's a perfect example. I love it. And it's definitely really one that can be hard to find sometimes. A lot of people just like following the algorithms and doing what people tell them. It's easier that way, honestly, much easier. So to really have that like desire and that wonder is something we look for. And then the next one is faith-seeking understanding. So, we really do seek the guidance of the church to understand things. I think there are, especially in the health world, things can get a little bit weird. Is that the right word? If you don't have something kind of guiding you in your learning. And so we do always kind of bring it back to, okay, what does our faith tell us about this, about the truth of the human person in the light of faith?
Right. Or maybe a kind of extreme but relevant example would be, if a boy comes in saying he believes he is a girl or wants to be a girl or something, we approach that from like, okay, well, our faith tells us that there is a nature that cannot be changed, and male is male and part of that. So we try and understand then, like, how do you help this person based on that fundamental principle that, well, he is a male and we're not going to deny that, but he's a human person who needs to be understood, needs to be helped, he's suffering or whatever. And we would work towards understanding this issue that he's having from a principle that we receive by our faith. And so the Christian anthropology, like the understanding of man, who he is, where he's going, who he's made by, and where he's intended to live forever, guides our healthcare treatment and our scientific inquiry into how to help people.
Yeah, absolutely. I love that example. And the other core value that we really seek after is having a servant heart. And I think most people going into the healthcare field typically have this already. You usually joined healthcare to help people. And so that one is easy to find in a lot of ways. But then also, I think a lot of us go kind of the extra mile, especially our primary care providers. We're available 24/7. So like my phone sits next to my bed and I'm going to answer it in the middle of the night if a patient calls. And that's inconvenient, but like that is like wanting to serve these patients in this population. And then also even just within the office of like, oh, we need to clean out the supply closet or paint or something, and people are like, oh yeah, let me help with that. Let me pitch in, and just having that, desire to serve as Christ served.
Yeah, because we've deliberately tried to select for employees who really, really embody that. And it's also very easy in healthcare to get burnt out and to get ground down and start seeing patients as numbers, even when you came in very optimistic into the healthcare system to serve. So we have to be very intentional too about feeding the souls of those we work with so that they're encouraged, that they have training in good boundaries and professionalism, but also continually challenged to come out of themselves to give and to remember the core purpose of why we do what we do.
Yeah, absolutely. One thing I love just talking about like our vision and our mission was this quote I found of vision without action is merely a dream. Action without vision just passes the time. Vision with action can change the world. And that's what we're trying to do. We're trying to change the world. So we took, our vision and kind of seeing it, how it played out over the last year. There's just a couple things that we've done. Again, a lot of this is more like behind the scenes of how we form a culture so that when you walk in and you're greeted with someone who's, happy to be here and who's answering your call, or, sitting with you through that counseling session, like they've been fed here at the clinic. And so something that we do to have that intentional culture is that we host Mass and Confession once a month here in the clinic. We actually just this year secured a chaplain, which was just really, really awesome. And we're so grateful for that. And so he comes once a month, says Mass in our tiny little chapel here in the clinic. If you've never seen it, feel free to ask to check it out. It's very peaceful. And again, that's just to help us really feed the staff and like make sure that they're well cared for. We also do a yearly retreat. So we did that this year. We had a retreat day out at the Carmel Center, about an hour away. It's really beautiful. Every quarter, we do a family event for everyone on our staff. So like we do a pool party in the summer, potluck in the fall. We went to Dollywood this winter, which was really exciting and fun, and also very cold.
Yes, it was.
I think it was like 20 degrees that day, but we were committed. We were going.
Yeah, and there was a lot of bonding in that. For all our
forced bonding. And then just this year, we started offering in-house childcare. I talked about it with Lucy on the podcast that we did, and that's been obviously a huge gift to nursing moms. And then we also host like little lunches where we do little Bible studies and things like that. So those are just a couple of things going on behind the scenes to, help our staff out and really create a culture that we love.
Yes, another area of intentionality that we put into place practically on the ground is spending money on continuing education for our staff. So over $6,000 for a relatively small staff that we have spent this past year on education. We have quarterly meetings. We have big annual meeting, regular weekly. Well, they have been weekly. They're less frequent now, but the mental health team meetings so that we discuss difficult cases or processes that we can improve and brainstorm together. Weekly primary care team meetings, similar idea. Yeah. Women's health, same thing.
Right.
And those are helpful venues to keep the teams connected and focused on having input to improve things and building trust with each other or continuing to deepen the trust. The implementing the Working Genius tool from Pat Lancioni has been
so fun,
interesting, and very, very helpful.
Insightful. Yeah. Absolutely. And I think too, like this goes along with like kind of the wonder of like, if we're going to wonder about all these things, like we have to have a way to like really dive deep. And so, at least on the primary care side, having that we have weekly meetings that are like 3 to 4 hours long where we'll really dive deep into a topic that's relevant and say like, okay, what is it that we recommend? We're getting information here and information there, but like, let's really dive in and figure out, what is best for cholesterol. And so that's really valuable. I mean, for us as providers, but obviously I think for our patients as well. And then I know the women's health, similarly, where they go to conferences and they're talking about difficult patient cases and whatnot. So it's been huge for us this year because we didn't really have that before because we didn't have like a full team, we're like adding people on. You can't really do that by yourself. And that's one of the huge advantages of having a team and multiple people is being able to work together like that. And then other little things that we've done, we've tried to give the office a little bit of a facelift, added some pictures here and there. We still have obviously our longer appointment times and root cause approach. And so, all of that we really had from the beginning has been in our vision of having this whole person care model. We've also, recently launched a membership that covers all of our different services, which has been really cool to see, being able to integrate everything together in a really tangible way. That's been fun. So when we looked at, this is technically looking at 2024 to 2023, right? We did this at the end of the year last year.
Comparing 24 to 23.
So in January, when we looked at all the numbers, we saw that we increased our employees. We had a 300% increase in the number of employees from year to year. So we went from having 2 full-time employees in 2023 to 6 full-time employees in 2024, which was exciting. I mean, I may just speak for myself that being able to employ people is one of the things that I never thought about in being an entrepreneur. I don't know if people think about that, but it was like, wow, providing a place for people to work is really awesome. So it's been really fun to be able to hire more people and see the office grow. Let's see, we increased our number of patients. We 64% increase. And so this number is technically from January, but we had about 2,060 patients enrolled at that time, which is really great.
Huge increase.
Yeah. And then our revenue increased by 55%, which is great, obviously. Really wonderful. We added in-house labs. So over the last year, we hired a full-time nurse, Jenna. If you've ever been here and had your blood drawn, she's incredible, as well as offering IVs. And so that's been a huge game changer to not have to send patients to a lab to have their labs drawn, and doing it here has been so awesome. And then obviously like Mike was saying, our mental health side really grew. So over the last year, we hired 3 out of those 4 counselors. So that's, really still in its baby phase, but we're working to grow that. And that's exciting. What about, these are just some fun statistics. I'll let you go over them because they're just...
No, they're exciting to say.
Yeah.
Just from our medical record system, we can see that in the year 2024, our providers wrote 2,403 prescriptions in 5,254 appointments and sent 28,936 text messages to patients and 12,160 emails.
Mm-hmm. That's a lot of text.
If you know healthcare, this is very, very revealing because, if you think, okay, we had 2,000 patients and we sent 28,936 text messages, that shows a degree of access to your doctor that is not found anywhere else, or that doctors would send 12,000 emails over the course of a year. The ratio of prescriptions to appointments is also fairly significant because it shows that families and patients are not receiving prescription for every visit.
Yeah.
Not even close.
Right.
Which means there's a whole lot of other methods and tools being employed to help keep people well or to, get them better.
Yeah, absolutely. It's always fun to see that. And also wow, we did do a lot of work. One fun thing from the past year too is that for the first time we were profitable for the year. Marginally, but it was there.
It was a black number, not a red number.
Yes. So that was really exciting for us. Another thing that we did over the last year is that we sent out, for the first time, a patient feedback survey or a customer impact or whatever you want to call it. And it was really awesome to just hear people's feedback, the good, the bad, the everything. I mean, it's just all so valuable to us to be able to work to be better. We still have a 5 out of 5 Google review score, which is great. Overall, everyone was quite satisfied. Obviously, there are a couple people that gave good feedback that maybe weren't satisfied, but we had a couple different things that people said that I thought were really great. Was that a human picks up right away when I call, which again is should be the standard.
Low-hanging fruit, right?
Yeah, yes. We're there. And then just, people taking their time during each visit to be able to connect and answer questions. A lot of people did talk about, that accessibility, the fact that I can text somebody, especially those new parents, I think find that especially valuable when you're trying to get through the first time parent phase and having somebody that you can call on, as well as, the intentionality and how personal care is here. So that was just really awesome to hear.
Yes, we had a lot of validation from that. And we also had a few themes that emerged as areas where we could challenge ourselves to grow more.
Yeah.
Which is very, very helpful.
Yeah, absolutely. So a little bit about, we're going to transition now from looking over the last year. Do you think there's anything else from last year?
No, that's about captures a year. If you can capture a year.
Yeah.
A lot has happened. It's amazing.
A whole lot. So looking forward to kind of this coming year as we enter into our 4th year of, being in business and serving people. One thing that we are hoping to do is hire a medical director. This was also on our goals for the last year.
Yes.
I think it's been on there since we opened, honestly. So if you know anybody who is a physician and you think would fit our culture well, we would just love to talk to them. I will also totally offer anybody a year free membership if they find us a medical director.
I think that's fair.
Because it is a needle in the haystack for sure.
Well, let me just say briefly what we are looking for.
Yeah.
And also clarify, we do have We do have a
supervising physician,
a super great supervising physician who is functions in the role of supervisor for our clinicians. But we are looking to expand. We have a wait list. We have a lot of patients and families who want to be seen. And it just makes sense that we are ready to bring on a full-time family physician who embodies these core values and understands this mission and wants to join us and help lead us to the next level.
Yeah, absolutely. And that was actually something in the survey that came back. There were quite a few people who were like, could you hire a male physician, please? And I wanted to reply back and be like, yes, I would love to hire a male physician, because we don't have like a male nurse practitioner and husbands only want to see males. And like, I totally get it. So yes, we would love to find that person this year. We've been praying for it. So spread the word. Something else that we are doing is on the kind of more primary care side, but really for the whole clinic, is I'm at least working on an online community that is going to hopefully host like a lot of the work that we're doing as like an online platform. And part of that is because our vision is not to like expand and expand and expand, right? Like people have asked us, are you going to open another clinic? Like, we have the demand for patients. We have, other providers who would love to join us, but like our vision is not to have like 5 different locations. And so we recognize that, like we're limited, obviously, and like who we can help and who we can see. But there are people out there who would really benefit from the information and the education that we're able to give our current patients. And so this online platform right now, we're going through like just a little group of people trialing it. It's not public, and really trying to refine how we do that and how we disseminate information and what's engaging and what's helpful and educational. So that's something that hopefully over the next year we'll launch. And that's really exciting for me to think about, just being able to reach more people with all the good things we've got going on here.
Yes, that's very exciting.
And then what about mental health group for the next year? What's your vision?
General, our goal this year is to consolidate and grow organically. So, as we have more patients and clients who want to be seen, we want to be able to bring on and fill out our mental health team, bring on more therapists. And similar to the primary care side, we would like to bring in a psychiatrist, be able to work on some medication management issues around more kind of severe or persistent mental health issues, and that will help fill out the expertise of the mental health team. So we'll see how. Yeah,
right now, or at least over the next year, we're slightly limited in our space. We have like just enough space maybe to add one more person to the mental health team, and we've got just enough space for that magical medical director that we're going to get, and then we're looking actively for another office. And so our lease is up in about a year, which seems far away, but I mean, it took us over 9 months to find this office. And so it is not an easy process. And similarly to looking for a house, you start off with this like list of like, these are the things that we need. And then slowly that list starts being like, you strike off, like, actually, do we need that? Do we have to have this? So it may be that we like look everywhere and come back to here and say, well, this is actually as good as it gets. Or maybe we'll be able to find something that fits our growing team. My vision, or our vision over the next, 3-ish years, is to grow to be just a little bit bigger. Not substantially bigger, that we're like, we never want to lose that kind of small office, small business feel, both for our employees and for our patients. So in my head, I'm like, okay, if we can fit 12 people around a table at lunchtime, if we get more than that, then everybody's scattered for lunch. And that just feels so much less personal. And so having, about 12-ish people in the office on any given day, to me, feels like the max. And so that's really what we're looking for, is a space that can fit a table that seats 12 people.
Yes.
We don't have that right now. And then being able to, have offices for those people is really the idea behind it. Great. I think the only other thing I'm thinking of that we haven't really touched on for this coming year is that we hope to have a couple retreats. I know there's some of the women in the office are working on a healing retreat for women in particular who've dealt with infertility or recurrent miscarriages, I believe. And so I know that's in the works and really looking forward to being able to do something like that here. And then the mental health team also is considering maybe putting on a retreat for like a day retreat.
Well, I think we're well beyond the considering. We are excited about doing it. It's just a matter of understanding where God's, what opportunities He's offering. Who do we want to provide a retreat for? What kind of methodology? How can we kind of get out there and serve? Mm-hmm. So yeah. Hopefully towards the fall 2025, we will be we'll be putting that on for a day.
Awesome! I'm so excited for that. And obviously, we'll keep doing our podcast and keep everybody as new people come on, bring them on the podcast, introduce them, and it's going to be a really, really great 4th year in business. I'm really excited for it.
I am too. God is blessing us, and it's a real blessing to be part of it.
Yeah. I feel like we're just along for the ride,
Mm-hmm.
And that's great.
We're lucky that this is the ride.
Yes, very, very grateful. Absolutely. Well, thanks so much, Mike, for taking time out of your busy schedule to sit down and chat. It's been great.
Love to. Thank you, Caroline.
Mm-hmm. Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.